So I'm super excited about this video. We are going to kind of walk through another video with Maud. This one happens to be on achy joints or for those who have arthritis. And let's go ahead and just kind of jump into it. My name is Dr. Chad Kuntz. I'm a sports physical therapist, and I like to continue to provide feedback because a lot of people like to do yoga, first off in general, and then secondarily, a lot of people who are in pain or struggling with movement kind of elect yoga as a key foundation that they should do. And a lot of the times they are correct. Not every time, right, is all yoga created equal and right for everybody. And so that's another reason that I wanted to kind of do some of these reviews with you and with Maud, because she's a leader in the yoga world, at least from what I can tell, particularly here in the Charlotte community. And she's really just been giving some great content, continuing to help people move, empowering people with movement, and I really want to get behind that. And so I wanted to provide some, I guess, not necessarily critique, but just kind of my angle as a sports physical therapist and kind of bridging the gap between yoga, I guess we could call it physical therapy, but it's more about optimization of movement and quality of movement is probably a better way of putting it. I just feel like the general scheme of physical therapy is too broad of an umbrella. We're all looking for optimized movement that's right for you. And I really loved her introduction here. She starts to say, listen, it's not for everyone. A lot of us are going to have at some point arthritis. It's almost the inevitable. Wear and tear, we're all fighting 9.8 meters a second squared of gravity every day. And so gravity continues to fight us. And unless we truly optimize our muscle firing and our core, the joints tend to take more of the brunt of that force than they need to. And so what I'm going to do is kind of walk you through my perspective here on how Maud's challenging your movement at a beginner level, especially if you have, like she said, rheumatoid arthritis, which can be, further down on the spectrum of irritability, sensitivity, and inflammation. And really with anyone who has flare-ups, it can be tough to move. It can be tough to want to move because you might have fear of movement. You might expect the pain to come. You might think that you're doing more damage. And so all of these are potential roadblocks telling you, maybe I shouldn't move. Maybe I should just sit here. It's easier. But I want to get behind the bandwagon to tell you, we need you to move. And so I think getting some level of an introductory, safe class or movement that you know is right for you is perfect. She really sits here and talks about breathing. And so first off, of note, she's in kind of a crisscross position, or Indian style, as you might hear it in kindergarten. That alone can be actually challenging for some people. All right. So she's obviously very flexible, not having any trouble with this. So the first thing I saw was someone who maybe is dealing with severe arthritis, maybe rheumatoid arthritis. A lot of that can affect the knees. Hip osteoarthritic changes can affect the hip. And so find a modified position for this Indian style or kind of crisscross seated position, because this alone can be very challenging for people. If you happen to feel more of a stretch on the inside of the groin, or maybe you feel it on the back somewhere, I think that's perfectly fine, and that's a good thing. But we don't want any pinching pain. We don't want any, pinching type of pain in the hips. We also don't want any irritation on the knees, because this is a lot of potential compression to the knee joints. And so when you're setting up shop, make sure that you are really comfortable kind of getting into it. There are some people in the yoga community that want you to kind of embrace the pain, to kind of, be comfortable with it and manage it. That's where I would kind of disagree. I want people to feel unbelievably comfortable before they get started. Even when people lie down and I'm about to work on them, the first thing that I do is make sure that they're out of this world comfortable. And that may take a little bit of a manipulation. So maybe you have a little bit less knee flexion. She's got some pillows set it up shop, and you could sneak a pillow under each knee. Okay? Some people may feel better. Let's see if I can choose a color that sticks out better. Let's try yellow. Some people might feel better if they bring their knees out to the side a little bit more. All right? Some of you, depends on your history of knee pain. Some feel better with more knee flexion than less knee flexion. So my perspective when kind of getting into this first position is make sure you're comfortable. There's, to me, no real rights or wrongs. I think finding your comfort first within as close of a position as Maud is recommending here is perfect. Now, one of the first dynamic motions she walks through after you guys kind of go through some deep breathing, and let me just take a step back. Deep breathing, getting the diaphragm involved, gets the parasympathetic system going. And all that's fancy jargon, meaning it helps you relax. I'm going to pause here because I want to say something on that. So with a lot of times, there we go. A lot of times we're in fight or flight if we've been in pain for a long time. Pain goes down, tells the adrenal glands pump out more norepinephrine and these hormones that keep us fight or flight. It's kind of like if a bear were chasing you in the woods. You'd better believe your hormones would be pumping and you'd be running away from the bear as much as possible. But our body's built to only transiently allow us to kick that on overdrive so that we're safe, right? Because that's one of the main things that our body cares about. We just want to survive, we want to be safe, don't want to hurt ourselves. When you're in pain for a long time, that sympathetic system is constantly upregulated. So just getting into a comfortable position, maybe even dimming the lights, making sure you're comfortable, and maybe even had a nice snack or food so you're not, stomach's not growling you, you're in a good sense of peace of mind. Getting the diaphragm, which is innervated by a parasympathetic nerve, and just taking some time to breathe before you do this is really important because, and let me draw something out here. Sensation when we're in pain, this is really important. Sensation does not equal perception when you've been in pain for a long time. So I say it again, sensation does not equal perception. So you might have, let's say, that level, if this were a bar graph, of sensation of pain. But if you're in fight or flight and you've been in pain for a long time, you're stressed, this and that's going on, your perception might be up here. And that's a representation, a bad representation of the fact that your perception of that sensation is a lot higher. And that might cause you to be fearful movement, and it might tell you to kind of step away from not wanting to do this. And it can give you kind of false alarms when doing even these introductory movements that maybe I shouldn't be doing this, maybe this isn't good for me. And so deep breathing, setting the mind right before you do this is really wonderful. Now I see absolutely zero problem. I think these are all super gentle motions as she kind of does side to side. Now we'll say this, if I were to back up a little bit, when you're doing side to side, she does this kind of intuitively. I'm going to pause her at the far end there. There's a lot that can go on here. You can kind of shift and, I would use the visual representation of like taking one segment and only moving that one segment. Think about the spine and kind of move it as one unit, the entire spine from side to side. Don't take one segment and move it alone. That's a tough cue to kind of think about, but you'll feel it when you're doing this. Make sure that you're kind of engaging your core a little bit. I like the cue of drawing the belly button back towards the spine. It's not a hard abdominal brace. You should still be able to breathe and talk when doing this, but that turns on a muscle called the transversus abdominis. It's a nice local muscle, which means it has attachments to specific vertebrae that you've most likely injured or have arthritis if you're watching this. And stabilizing that can be really, really important. And then we move in what's called the sagittal plane, or you're moving forward and backward. Now, I like as she rocks backward that even her knees kind of come up a little bit. So I'm a fan of that because a lot of you will try to brace and extend only from your lower lumbar spine. And that's where a lot of people get into trouble. So it's just a holistic, whole body movement back and forth, what she's representing. And I think that's fantastic. When you lean forward, the same holds true. Don't try to overly arch your low back when doing that, okay? That's one of the key things I think you should take away from these spinal movements. Most of you have had experience or at one point and another had low back pain in just the low back. And that's typically what we call the L5 or L4 even, or S1 joint. So teach your body how to move the entire spine and as one unit. And now we get into more of what's called the transverse plane. She's kind of rotating. It's a really good thing to kind of rotate as she's showing here too, because you're also going to get the middle vertebrae, or what's called the thoracic spine, to move a little bit more. Typically those who have low back pain, or have had low back pain, or sciatica, or piriformis syndrome even, they don't move the middle part of their spine. They're only low back centric. And so even if you have arthritis in the low back, think about it as just wanting to distribute force equivocally throughout all of the segments. It's kind of like, I like to think of it as work and translate it into something we can digest. So think about assemblymen, okay? Let's say there's 24 assemblymen and they each have their role and they each show up for an 8-hour day. What if 2 of those guys were the only people that were working? And now they're working 18-hour days and they're trying to cover the jobs of the other 22 people. You think they're stressed? You think they're tired? You think they're hurting? You think they're irritated? Absolutely. So our low back is really no different. Now she kind of just moves into some gentle side neck flexion. And from my experience, this is a couple of movements that get really stiff in the spine. We, instead of rotating our neck, we'll start to rotate our whole body. So you might be in a car, instead of looking at that, you would kind of, rotate the whole neck. So we tend to avoid pure side to side motion, and instead we usually use what's called a composite motion, where I'll side bend, but I'll also flex, I'll also rotate, and that's more natural movement. So when you take specific time to think about the quality of your and your ability to only side bend, it's a really good thing. You might even notice you have to look in the mirror. I'll let her play because we'll talk about that in a second. You might even notice when you look in the mirror, when you do side to side, that you actually naturally rotate. So you might actually be here rather than learning how to only side bend. So believe it or not, that's actually quite a good skill set that you should practice. So obviously it's good to just relax and be in the moment. And then there's also kind of the idea that pay attention to the quality at which you do this. And is your neck and head where you think it is when you're doing these movements? Sometimes it's not. And that's what's called proprioception, which is vitally important to helping you move better and pain-free. Because you need to know how to move this engine, right? That's like someone trying to fly an airplane and they only know where half the buttons are and what half the buttons do. Yeah, that probably wouldn't go so well. So Maud did some very gentle flexion extension. I will say more people probably benefit from going into flexion and more people struggle with going into extension. So be definitely mindful of extension when you're doing just the neck. And same holds true with the low back. When you're doing the neck, most people only move from the lower neck. So instead, think about moving all of the neck vertebrae. When you go into rotation, just practice the idea of kind of keeping the chin down a little bit as you rotate. In my experience, for those who have arthritic necks, who have had car accidents in the past, who have had pinched nerves or tight muscles in their trap areas, when they rotate their neck, they'll actually lift up. The chin will actually naturally come up when you'll be in this extension mode. So getting into a little flexion as you rotate, you might notice is tighter, tougher. And some of you might even hear some noises kind of when you're rotating or moving the neck. Don't be alarmed with noises. Noises just mean the joint's moving. If you're kind of getting something like it feels like it's almost going out of place, and there's sharp pain with that, then we've got something to talk about. But if it's just noises and cracking, it's not a problem. Okay, so now Maud is doing a really nice gentle stretch to her nervous system, in my opinion. Okay, so she's getting a nice gentle pull this way, and there are a host of nerves that need to stretch out. So just to kind of paint it on her, when she was doing that, the cervical plexus is about right here, and then when you reach out, like let's say her right arm was coming up to the side here, the nerves have to go underneath the armpit. And so really when you're kind of reaching out to the side like that, I think partly what she's getting is a beginner's level neural stretch. And believe you me, nerves need to stretch. We tend to think about muscles only in isolation when you're stretching, but you need to stretch nerves. More often than not, people have a nerve problem and they think they've got a muscle problem, or they might even think they've got a joint problem. But more often than not, they know it, they've got a nervous problem. So doing a little bit of stretching and considering the idea that you're actually stretching more nerves than you think is incredibly helpful. We're getting some wrists to move as we get older. Wrist, hands, especially the thumb, common areas for arthritic changes, especially osteoarthritic changes, and getting the elbows to move the way she did, kind of going into flexion extension. Really shouldn't be much of a problem here. Okay, unless you've had, for whatever reason, some sort of history, like maybe an extended gymnast might be someone who's put a lot of work on their elbows. But generally speaking, I think the elbows are going to be a pretty safe place to move. She then moves into scapular and shoulder kind of circular movements, which is a really good thing for us to practice because we all hold so much tension up in our traps. We tend to squeeze. Some of you may have been taught to kind of squeeze your shoulder blades down and back all the time. And it might shock you to hear that I'm not necessarily a fan of that. I won't get in too deep into that. But generally speaking, getting the whole shoulder blades to move and to get them to move symmetrically and make sure that they feel like symmetrical from one to another is going to be really helpful. Okay, so I believe now I want to go into this stretch right here. So she's kind of rocking to the side. And what I like about this one, she's got some nice support here. Very respectful to the fact that this is a sensitized potential class. We need to be respectful of potential pain. And so this can be a really good area to stretch the QL. And then I'm going to also take her back because I want to show you one more time. And then while she's doing this too, you get a really good stretch into the lats. So the lats are kind of sitting right here, and then they run into her backside. The lats run all the way down into the middle part of the back. So between that, the rib cage, the muscle called the QL, really, really good stuff. I think that's a wonderful stretch, and most people ignore the fact that our spines should stretch like that. Make sure you're not hinging too hard here and crunching into it. So I like the fact that she's giving you some pillows to play around with that. Some of you may be able to, need more support a little higher up. Totally fine. Some of you may realize, I don't know if I need these pillows. I'm going to take those away and I'm going to put my palm down on the ground. Really go for it with some breathing and really get into a bigger stretch with that. Okay, so now we're doing side to side. I tend to find that we develop these kind of subtle asymmetries in our spine from side to side and even in rotary movement. And heck, this also includes the shoulder too, right? So pay attention to where you're feeling the stretch. And all I want you guys to do at this point is just be aware to where you're feeling it, because that's going to clue you into information. If there's ever a bigger problem down the road, when I ask my clients, what have you been aware of and what have you experienced, the more information, the better. Okay, so now we're getting into more thoracic spine mobility. Very nice. So the thoracic spine is the middle part of our spine. It often becomes stiff as we get older. So if you're catching my drift here, the low back and the neck tend to be the mobile places in the spine. It's just the way we end up moving, unless we're really cognizant about it. The thoracic spine tends to unfortunately be the tighter of the three areas of the spine, and we don't necessarily move well there. And so I encourage you, as you're practicing movement here with Maud, think about how does that translate to my everyday life. If I go to grab my coffee cup, if I go to grab my newspaper, if I go to grab my phone, right, the way I'm moving, can I start to feel, in that case, the middle part of the back, the thoracic spine, moving more often instead of just hinging either in the lower back or in the neck, right? We don't want to just pivot on one joint. We want to feel like we're using all of the joints together. That'll prevent ongoing wear and tear to one joint, and that's really the problem. We know that we're gonna put some level of wear and tear on the spines as we get older, so you just want to distribute that. I can't say that enough. Okay, so Maud goes into some really nice pelvic circles. All right, so what I really like about this is that we're getting a good amount of hip flexion on both sides. If you've got osteoarthritic hips and it hurts to bring your knees straight towards your chest, let them fan out a little bit. So the way you can think about that is let the knees spread apart but keep the heels together, and that's going to put you in what we call hip external rotation, and that can really kind of open up the spine, open up the hips, and give you a better chance at feeling the movement where you need to. Yeah, as she's pulling her knee to her chest, good for hip flexion, good for stretching out the back. What I'm going to encourage you on this opposite side is to kind of drive down through the opposite heel. That'll get your glutes firing up a little bit more to help stabilize this. And make sure that you're really pushing down through your lower back, through your lower spine. Because if you don't push down through here, and let's say that she arches instead, then we've got a problem. Then we've got a problem usually right in here, if I were to illustrate that on her. And that's usually where hip impingement comes into play. And it might even be bothering that old hip. It could even be bothering the back, and I've seen both with that. So keep that in mind when you're kind of going into some of these hip flexion stretches. Okay. So the next part that she gets into is, from what I can tell and what looks like to me, is more nerve flossing. You might be like, what? She's only moving her foot. So the reason that she might be stretching out some key nerves that are coming from the low back or and sciatica, when you move the foot, particularly towards the nose, you are putting a maximal tensile force on the nerve. And it had to travel all the way from the back all the way up. And when you move just the ankle like she showed us a second ago, kind of in this circular motion, it's nice because you hit a hot spot, but you just come out of that, hit it a hot spot, and that way it's more comfortable, but you're still kind of informing your nervous system, hey, we're going to need to stretch out more. You're going to get some more blood flow into the area, and that's adaptability. And that's what the great thing about the human body system is, just how amazing it is. It is adaptable. She moves also into kind of some hip circular motions. Usually the yellow flag or red flag or danger zone is when she moves her knee that way. So the knee kind of comes across the body. That's where you're most likely sensitized to hip impingement. So really kind of keep that in mind. Don't push into that, particularly if you have hip pain. You might experience your back move in some different ways when you move your hips like that, as she just did in some circles. Know where you're at, know where your limits are, but feel free to explore that movement just like she's showing you there, okay? We're back into what I consider a nice hamstring stretch and a neural system stretch. You'll see that a lot of these movements, I've got my eyes on the nervous system, because most people don't. Most people right there might think that they're just stretching out only their ankle or only the hamstring. And the reality is you're also getting a nervous system stretch, which can be really helpful. And if some of these things help, it may be also the fact that you're getting some really key nerves to stretch in addition to ankle mobility and the hamstring muscles. I'm not ignoring the muscles, but I want you to be considerate of the fact that there are some other things stretching there too. Okay. So we've got a very good restorative cool down position here. All right, so you brought both the knees all the way up. Again, she's flexible, so that feels easy to her, good to her. You need to kind of feel where you can let your back go. I would probably encourage in this position just to feel a gentle stretch. Don't push into it too hard. See if you can keep a little bit of that tension to the low back. Remember that transversus abdominis muscle I talked about? So just pulling the belly button back towards the spine. and then see if you can relax quite nicely in this position, okay? But it's just a really good restorative position to kind of get into. Now, when you get up, and as you're transitioning, I like going into this side lying position. The one thing I'll say is that as you make that transition into your side lying position, I see a lot of people that arch their spine. So when you transition into the side lying, same idea. Keep your core firing. Don't let yourself arch. And make sure that you're kind of doing what's called a posterior tilt, or encouraging your lower abdominals to kind of scoop a little bit, especially as you transition from the side lying fetal position back up, because a lot of people will make transitional movements the wrong way. Okay, so great job, Mon. I think this was fantastic. I think she did a really good job. Not that she needs my approval, but I definitely approve this for those who have arthritic changes. It could include in the spectrum of osteoarthritic changes, rheumatoid arthritis, or even something else that I haven't mentioned. Very respectful to movement, giving you an opportunity to not push into anything that you don't have to. She's very respectful to movements that are commonly harmful to people. And hopefully my angle as a sports therapist kind of superimposed on how a yoga instructor, a very good one, might look at it. Hopefully you could kind of see a couple different ways that we're all looking at the same movement. And to me, it really is all about optimized movement and the quality of movement and the awareness of how you're doing that. Now that's the golden ticket right there. So I hope that was helpful. Keep up the great work, Mon. And I hope that you guys can continue to do her classes and participate with those, because I feel like there's some of the best out there, and there's a lot of respect to really the high level of quality movement that she is considering. So thank you so much, and have a great rest of your day.